I'm Dr. Sri, I'm a board-certified primary care sports medicine doctor. In this video, I'm going to show you a step-by-step plan for lateral ankle sprain to get your injured ankle all the way back to normal and return to the activities that you love. So without further ado, let's get started. So the goal of the lateral ankle sprain rehab is to strengthen the supporting muscles of the ankle, let the ligaments heal, and also strengthen the proximal kinetic chain, which is basically the hips that provide ankle stability as well. So I've divided this rehabilitation plan into 4 phases. In phase 1, we'll be focusing on improving the pain, the range of motion, and decreasing the swelling. In phase 2, we'll be focusing on doing a lot of isolated strengthening exercises for the ankle. In phase 3, we'll be doing a lot of functional weight bearing exercises to improve the strength and balance. In phase 4, we'll introduce a lot of single leg challenge exercises to build the resilience so that you can get back into your sport safely. Now let's get started with phase 1. So let's say you just had an ankle sprain and your ankle is like severely swollen and painful and not able to weight bear a lot. You will start with phase 1 here. So during phase 1, our goal is to control the swelling and decrease the pain and improve the range of motion. So during this time, some people may be able to partially weight bear, some people may not be able to weight bear as well. So sometimes I'll put patients on crutches, sometimes they may need a fracture boot, or let's say the ankle sprain is not that severe, then one can consider using a lace-up ankle brace or a figure-of-8 brace that you can buy from over the counter. But this should be more a personalized plan from your doctor. So in this phase 1, we're going to just only focus on gentle movement exercises for safe activation of the joint as well as the activating the muscles as well. So the first exercise is called as the alphabet exercise. For this exercise, we're going to put our ankle on a stool like this and let the ankle hang off the edge just like that. So now all I'm going to do is I'm going to draw alphabets from A to Z. So using my great toe, so I'm going to draw the alphabet. So A, B, C, D. And during this time, when you have limited range of motion because of pain and swelling, you may be able to only do just this. And that's okay. That's what we're going to focus on, is like basically slowly improving the range of motion, slowly improve the plantar flexion, the dorsiflexion, the inversion, the eversion movement by drawing the alphabet. So once you finish drawing the alphabet from A to Z, I would consider that's like the completion of that particular exercise. So the next exercise is called as the seated isometric inversion. So for this exercise, you need a soft towel, or you can use a soft ball just like this. And you're going to put the ball in between the feet and the wall. So I'm going to assume that this is the wall so that it's more like a stable surface. So I'm going to put the ball onto the wall, basically between the wall and the foot. So what I'm going to do is I'm not going to move my ankle much, because during this phase your ankle might be swollen, you may not be able to do a lot of range of motion like this. So all you're going to do is that you're going to keep the foot on the ball, and then you're going to squeeze or you're going to push that ball onto the wall. So let's assume that this is a towel. The same thing you would do is that you're going to push that towel onto the wall. So while I'm doing that, I'm isometrically contracting the inverter muscle, so basically the posterior tibialis muscle, and this way you're going to activate the muscle. So what I'm going to do is I'm going to hold this contraction for 3 to 5 seconds. So it's going to be like this, like 1, 2, 3, 4, 5, and then relax. Again, 1, 2, 3, 4, 5. You can see that I'm isometrically contracting and pushing it, because you can see how the ball changes its configuration here, right? So I'm basically pushing it. I'm not moving the joint a lot. I'm squeezing that. I'm squeezing that ball. I'm keeping that isometric contraction in the muscle and then relaxing after 3 to 5 seconds. So the next exercise is called as the seated isometric eversion. For this exercise, we're going to activate our evertor muscles, basically the peroneal muscles. For this, again, same thing, you're going to put a ball or a towel between the wall and the foot. And then, again, without moving the joint, I'm pushing my ankle away towards the ball, squeezing the ball, holding the contraction for like 3 to 5 seconds, and then relax. Again, squeeze 1, 200, 300, 400, 500, relax. Again, 100, 200, 300, 400, 500, relax. So I would recommend doing the seated isometric inversion for 1 minute straight, where you hold the contraction for 3 to 5 seconds, relax, hold the contraction for 3 to 5 seconds, relax, and you continuously do the exercises for 1 minute straight. And similarly, you would do this exercise, the seated isometric eversion, for 1 minute straight. So if you think about the 3 exercises that we talked about, the alphabet exercises, the seated inversion, isometric inversion, isometric eversion, it would take like 3 to 5 minutes to complete the whole circuit. And I'll repeat the circuit at least 2 to 3 times per day to continuously focus on improving the range of motion. So as you continuously do this exercise pretty regularly, you'll start to notice that your swelling, your range of motion, your pain gets improved. And for some people it might be day 3, for some people it might be day 5, for some people it might take up to like 2 weeks or so. But once you can get good range of motion in your ankle in all 4 planes, so dorsiflexion, plantar flexion, inversion, eversion, then you're ready to move on to phase 2. So for phase 2, you will need a resistance band, and you can buy this resistance band anywhere from Amazon or Walmart or any sporting store. I'll get a resistance band that goes in few different colors from lighter to heavier, and I'm going to choose this red one here, which is kind of like slightly on the heavier side. So we're going to focus on isolated strengthening exercises in this phase, and our first exercise is called as the resisted banded inversion. So when we say inversion, so we're talking about a movement where we're going to bring the ankle inside. So this is inversion. Whereas if I take the ankle outside, that's called as eversion. For the banded resisted inversion exercise, I'm going to loop the band around my foot. And then this is going to be the affected ankle. So I'm going to cross my leg this way, and I'm going to bring my foot a little bit away, this foot a little bit away, so that I create a little bit of tension on the resistance band. And then I'm going to bring my ankle inside. So this is the inversion movement. So we're going to bring the ankle inside. I'm going to bring all the way inside, and then I'm going to keep a squeeze for like 1 to 2 seconds, and then relax. Again, 1, 2, relax. 1, 2, relax. 1, 2, relax. So we're focusing on strengthening our posterior tibialis musculature here. And I would do this exercise for a total of 1 minute straight. The next exercise is called as the resisted banded eversion. For this exercise, again, we're going to loop the band around our foot. Now, this is going to be the affected ankle here. So I'm going to spread my legs a little bit so that I create a little bit of tension in the resistance band. And I'm going to bring the ankle away from my body. So basically, I'm going to push outside this way. So it's going to be 1, and then same. So you're going to hold that squeeze for 1 to 2 seconds, and then come back to the starting position. Hold the squeeze for 1 to 2 seconds, and then come back to the starting position. And I would continue doing this exercise for a total of 1 minute straight. So the next exercise is called as the resisted banded dorsiflexion. For this exercise, I'm going to loop the resistance band again around my foot, but I'm going to bring my affected ankle. So let's say this is my affected ankle here. I'm going to bring my affected ankle on top of my shin like this, and I'm going to put my foot in such a way that there is some amount of resistance on the band. And now the band is kind of pulling me towards this way, but I'm going to bring my ankle towards me, hold this contraction for like 1 to 2 seconds, and then go back to starting position. So again, 1, 2, 1, 2, 1, 2. So I'm going to do this exercise for a total of 1 minute straight. So the next exercise is called as the seated calf raise. And for this exercise, I'm going to find a stool just like this. And let's say this is the affected ankle, and pretty easy exercise. All I'm going to do is I'm going to focus on my plantar flexion. I'm going to squeeze my calf as well. So what I'm going to do is that I'm going to bring the heel all the way to the top, hold the contraction for 1 to 2 seconds, and then relax. So maybe 1, and then hold the contraction for 1, 2, 3, and then relax. Again, bring it all the way up, hold the contraction, 1, 2, 3, and then relax. So I'm going to do this exercise for a total of 1 minute straight. So the next exercise is called as the side lying hip abduction. And we're going to focus on strengthening our glute muscles here. So for this exercise, I'm going to lay on my side, and then I'm going to stack my leg on top of each other. And then I'm going to this is going to be my working leg. So I'm going to bring my leg up like this, bring it forward, make an interrotation where the ankle is pointing towards the ground, and then bring it back. And I'm going to hold this position for a total of 1 minute, but you can preferably do 20 seconds, take a 10-second break, then 20 seconds, then take a 10-second break if you feel like you're not strong enough to hold this contraction for a total of 1 minute straight. And once you hold this contraction 1 minute straight, then you're going to turn and then you're going to work on the other leg as well. At the same time, if you feel like you need more challenge for this exercise, you can use a resistance band just like this. So I'm going to bring my ankle, inter-rotate, and then bring it back. And now I'm going to hold this contraction for 30 seconds to 1 minute. And because of the resistance band, this is quite challenging, where I already feel like my glutes are getting fatigued right now. And again, you can use whatever resistance band that you prefer to increase the challenge of this exercise. So this whole circuit may take anywhere between like 6 to 7 minutes to complete, and I recommend repeating this circuit at least 2 to 3 times. This whole workout I recommend doing at least 4 to 5 times a week. So as you continue to do these exercises, your range of motion will be completely back to normal. You should be able to weight bear without much pain, and that's when you're ready to progress on to phase 3. In phase 3, we'll be doing 4 exercises. The first exercise is called as the slow tempo bodyweight squat. For this exercise, I'm going to stand on a shoulder width apart, and the slow tempo basically means that we're going to do the squat slower. So I'll probably take like 4 to 5 seconds to lower myself down and then come back up in like 1 to 2 seconds. So the exercise is going to be 100, 200, 300, 400, 500, and then come back up. Again, 100, 200, 300, 400, 500, and then come back up. Okay. So now, with your history of ankle sprain, you might notice that you come here and then you cannot lower yourself down, or if you have to lower yourself down, you might have to lift your heel up in order to come down. What I would recommend is to avoid that, but rather focusing on improving the ankle mobility range of motion every time you do the exercise. For example, the week 1, you might be here. Week 2, you might be here. Week 3, you might be here. So the focus is that as you continue to do this exercise consistently, your ankle range of motion will improve, your quads and glutes will get stronger as well, you're strengthening the stabilizing muscles of the ankle, and eventually your goal is to lower yourself as much as possible. And don't worry about your toes going beyond your knees going beyond the toes. That's totally fine. And then just focus on continue doing this exercise, improving your ankle range of motion. So gonna be like 100, 200, 300, 400, and then relax. Again, 100, 200, 300, 400, 500, and then come back up. Okay, and I would do this exercise for a total of 1 minute straight. So next exercise is called as the monster walk. For this one, you're going to find a resistance band that is going to be adequately challenging, and I'm going to loop the resistance band around my thighs. So once I've looped my resistance band around my thighs, I'm going to stand on a shoulder width apart, creating the tension in the band. So I'm going to create a small, mild hip flexion here. So instead of standing like that, I'm just going to stand with a slight hip flexion, slight knee flexion, so basically a slight knee bend here. And then I'm going to go this way 5 times, and again this way 5 times, and then forward 5 times, and then going to backward 5 times. So it's going to be like this. So 1, 2, 3, 4, and then 5. Again, 1, 2, 3, 4, 5. Okay. Now I'm going to walk straight. So I'm going to walk in a zigzag manner. 1, 2, 3, 4, 5. And then I'm going to walk backwards. 1, 2, 3, 4, 5. And then again walk sideways. So I would do this whole 5, 5, 5, 5 for a total of 2 minutes straight. So next exercise is the double leg calf raise. So you don't need a stepper, but in order to increase the challenge, I would recommend getting a stepper, or you can find a stair that can help you to increase the challenge as well. For now, I'm going to start on the floor. I'm going to rise all the way up, lift my ball of the feet, squeeze my calf, and then I'm going to come back down. Again, lift all the way up, squeeze the calf, and then come back down. You can use the wall for balance if needed. But again, once you find that this gets easier, then you can find a stepper to increase the challenge. So I'm going to go up all the way up, squeeze my calf, but now this time instead of the floor, I'm going to get a good calf stretch all the way down. Again, all the way up, squeeze, and then come back down slowly. Again, up, and then come back down slowly. So you can see as I put the stepper, I'm able to enhance the stretch of the calf as I do this exercise. So I recommend doing this exercise for a total of 1 minute straight. So the next exercise is called as the single leg balance. For this exercise, it's a pretty basic exercise. You're going to lift one leg up and you're going to balance on one leg for a total of 30 seconds. And I'll repeat this for the other side as well. But let's say if this one becomes easier, then you can close your eyes to increase the challenge of this exercise. I've had multiple ankle sprains in the past and therefore this closing my eyes actually gets pretty challenging for me. But let's say if you feel like this one is becoming easier as well, you can start to create some unstable platform and thereby again increasing the challenge. So one example would be to find a wobble board just like this, where I'm going to stand, balance my leg on a wobble board like an unstable platform, and I would try to hold this balance for 30 seconds straight. But let's say if you don't have a wobble board, you don't have to invest in a wobble board just like this. You can just find a towel and you just roll up the towel and then you can stand on the towel similarly like this, and that also will create an unstable platform, thereby challenging your balance. As I said, I would hold this balance for 30 seconds on one leg and 30 seconds on the other leg. So in order to complete this whole circuit, it may take anywhere between 6 to 7 minutes, and I recommend repeating this circuit 2 to 3 times to get an effective workout. And I recommend doing this workout 3 to 4 times a week. Once you feel like these exercises are getting easier and you're getting stronger, then you're ready to move on to phase 4. So in phase 4, we have 4 challenging exercises. The first exercise is called as the slow tempo lunges. So this is going to be an advancement from our bodyweight squat, again focusing on ankle mobility, focusing on creating a little bit more challenging balance as well. For this exercise, you're going to stand in a staggered stance or a lunge stance just like this. And then I'm going to slowly lower myself down. So the goal of the exercise is to go to a lunge position. So take like 3 to 5 seconds all the way down. You will see that my knees are actually going past the toes, and that's okay. Again, as I said, the focus of the exercise is not only to strengthen the quads, the glutes, but also to strengthen the supporting muscles and also to improve the ankle mobility as well. And then I'm going to come back up. So it'll be like 100, 200, 300, 400, 500, and then come back up. 100, 200, 300, 400, 500, and then come back up. So when you've done the bodyweight squat, your ankle mobility would have improved, but again, this is another challenging version of an exercise to improve your ankle mobility as well. And I would do this exercise for a total of 1 minute straight, where the tempo is going to be, you're going to lower yourself for like 3 to 5 seconds. So it's going to be like 100, 200, 300, 400, 500, and then come back up. So I would do this exercise for 1 minute straight on one leg and repeat that on the other leg as well. So next exercise is called as the monster walk, except that this is going to be an advanced version where instead of looping the band on the thighs, I'm going to loop the band around my ankles. And then I'm going to stand on a shoulder width apart, where I'm creating a resistance on the band as well. And again, similar position where I'm creating a little bit of a trunk flexion, hip flexion, a little bit of knee bend as well. And then I'm going to go this way 5 times. So 2, 3, 4, 5. And then again 1, 2, 3, 4, 5. And I'm going to walk forward in a zigzag manner. So 2, 3, 4, 5, and walk backwards 1, 2, 3, 4, 5. And I would do that again, the whole thing, for a total of 2 minutes straight. So the next exercise is called as the single leg calf raise. In phase 3, we did double leg calf raise. Now we're going to increase the balance and also increase the load as well. So I'm going to lift one leg up, and then this is going to be the working leg, and I would use a wall for balance if needed. Again, it's important to make sure that you don't put a lot of balance here. I'll probably put like 1 finger or so just to have some balance there. And I'm going to rise up, lift the balls of my feet, squeeze the calf, and then come back down. So lift up in like 1 to 2 seconds and then slowly come back down. 100, 200, 300. Again, lift up, again 100, 200, 300. And once you feel like this one is becoming easier, then you can use a stepper to increase the challenge as well. Same way, except that same way, we will be focusing on improving our the full gastroc stretch, basically the calf stretch, as we lower ourselves down. So again, lift one leg up, and I'm going to enhance the stretch all the way down, and then lift up all the way up, and then come back down slowly. 100, 200, 300. Again up, again 100, 200, 300. Again up, 100, 200, 300. Again up, 100, 200, 300. Okay, so I would do this exercise 1 minute on each leg. So next exercise is called as the star reach balance. So let's imagine the clock. So let's say this is 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. I'm going to balance on one leg, and I'm going to reach with my other leg to 12, 3, 6, and 9. And I'll do this whole cycle for a total of 90 seconds, and then I'll repeat this for the other leg. So the exercise is going to go like this. So 12 o'clock, and then 3 o'clock, and then 6 o'clock, and then 9 o'clock. Again, 12 o'clock, and then 3 o'clock, and then 6 o'clock, and then 9 o'clock. Okay, so once you're done with this leg, repeat on the other leg as well. And again, this would take a total duration of 3 minutes to complete, 90 seconds on one and 90 seconds on the other. So this whole circuit may take anywhere between 9 to 10 minutes to complete, and I recommend repeating the circuit at least 2 times to get a good effective workout. And I recommend repeating this workout at least 3 to 4 times a week. And this way you're really strengthening your ankle, you're strengthening the proximal kinetic chain. And again, you're not only rehabbing your ankle, but we're also making sure that we prevent future ankle sprains as well. I usually tell my athletes to wear an ankle brace for at least 3 months after an ankle sprain. And again, as you can see, sometimes to finish a complete rehab, it may take anywhere between like 8 to 12 weeks to complete. And until then, I'll recommend wearing the ankle brace. And some people choose to wear the ankle brace forever. Some people want to wean off the ankle brace as they get stronger, and that's totally up to the athlete. But again, let's say if you're an athlete and if you want to get back onto the sport, I would recommend getting into a sport-specific return to sport, which will include a little bit of more high impact and and more challenging plyometric type of activities. And if you want to do a 10-minute guided routine with me, then check out this video here. If you want to know how I diagnose and treat ankle sprains in my office, then check out this video here. I hope this video was helpful. If you really found this video helpful, please make sure to hit the like button and put some appreciated comments in the comment box. This will really help out this video as well as my channel as well. And I'll see you in the next video. Until then, goodbye.